In Genesis chapter 2, verse 21-22, the Bible says God took one of the ribs from a man and created a woman named Eve. But the biggest question is, does it mean men have got one missing rib and probably women have got an extra rib? Let's find out together. But please know this session has got no any religious interest. It's just out of curiosity for the love of knowledge. What's up, ladies and gentlemen? Welcome back to NeuroSketch with Dr. Ken. But if this is the first time you've seen this channel, don't forget to subscribe to keep in touch. Today we're discussing anatomy of ribs, and without further ado, let's dive right in. Same like thoracic cage, and these words are used synonymously, but they refer to this bony framework that form the chest and protect the organs that are lying deep within it. The thoracic cage is anteriorly formed by the ribs, which are attached to the sternum by the way of the costal cartilage. So anteriorly, the thoracic cage is made up of ribs, the costal cartilage, and the sternum. But posteriorly, these ribs, which is very, very important, these ribs are connected to the spine. But which part of the spine we say the other time is thoracic spine. So the ribs are connected to the posteriorly to the thoracic spine, not lumbar, not cervical. What is a normal human being is expected to have 12 pairs of ribs from in each side. 12 pairs of ribs. A normal human being is expected, regardless of the gender, regardless of what we might have thought about. A normal human being is expected to have 12 pairs of ribs. What are the two take home? 12 pairs of ribs, which means 24 ribs, but also these ribs are connected posteriorly to the thoracic spine, not lumbar, not cervical, not lumbar. In a rare situation, we can have someone can be born congenitally with an added number of ribs, deviating from the 12 pairs. But what have we said? These ribs are expected to originate from the thoracic spine. But we have in a rare situation, someone can be born with a cervical rib, the rib that is found in the neck, and it's also known as the neck rib. And this is the neck rib, and it usually emerged as an overdevelopment of the transverse process of C7 vertebra. Transverse process of C7 vertebra. It has got no any physiological function. The cervical rib has got no any physiological function, and this is what we see. It's usually found incidentally and imaging incidentally. Most of people, they do not know that they have the cervical rib until they're going to do the imaging. And it goes most of the time it's harmful. It's not harmful. It causes no harmful effect to the patient, but in a minority of situation, it can be symptomatic, causing the symptoms due to the compression of the neurovascular structures that are passing near to the cervical rib, and as in a condition of the thoracic outlet syndrome, as we're going to discuss. This is a discussion next time. Don't forget to subscribe, keep in touch. The next discussion we're going to talk about the thoracic outlet syndrome in the thoracic region. But yes, this is the cervical region. Someone can have bilateral cervical ribs, but it can also be a unilateral cervical rib. It has got no any physiological function. But you can also have a lumbar rib, but this one is not very strange as having a sacral rib. In a very, very extremely rare situation, which happens once in a blue moon, someone can be born with the sacral rib. This one, the sacral rib, is found at the sacrum, attaching to the sacrum, and it's a very, very rare situation, congenital normal, that happens once in a blue moon. But we've said a normal human being is expected to have 12 pairs of ribs, and someone can have a supernumerary ribs. A supernumerary ribs in a situation someone has got more than the expected number of ribs, but someone can also be born with congenital absence of a rib. So maybe he or she will be short of 12 pairs of ribs. One among the obvious function of the ribs is protective function, because deep within the chest lies important vital organs, but the ribs are connected to the sternum by the way of the costal cartilage, and this one, they are synovial joint, as we discussed the other time, and they provide flexibility of the chest of the ribs, and this flexibility actually gives room for the lungs to expand, and this aids in respiratory movement. Ribs being the long bones, they help in formation of blood cells in a process known as hematopoiesis or erythropoiesis. erythropoiesis. We have 12 pairs. I'm repeating again. We have 12 pairs of ribs, and these ribs can be divided into 3 groups depending on the way they articulate, the way they connect to the sternum. The ribs which are connecting directly to the sternum by the way of their own costocartilages, they are called the true ribs. True ribs, they attach to the sternum directly by the way of their own individual costocartilage in such a way that each rib has got its own costocartilage. So what are these ribs? These ribs, because they are coming from the vertebra, from the thoracic vertebra posterior to the sternum, directly to the sternum, they are called the vertebro-sternal ribs. Vertebro-sternal ribs. So what are these? You see rib number 1, rib number 2, number 3, number 4, number 5, number 6, and number 7 has got its own costal cartilage. These are referred to the true ribs. So these are the true ribs. But we have ribs that they rib number 8, 9, and 10. They do not have the direct contact with the sternum. They do not articulate the sternum direct, but they are using the way of the costal cartilage of rib number 7 to go. They invest using the rib costal cartilage of rib number 7, and these are the we call them the false rib because they do not have the direct contact. Their connection with the sternum is indirect by the way of the rib cartilage of rib number 7. So because they're coming from the vertebra into the costal cartilage, they are called the vertebrochondral ribs. Chondro means cartilage, vertebrochondral ribs. But the remaining 2 ribs, they are coming from the sternum. They're coming from the spine, from the vertebra, but they are floating. They give an impression of floating because their costal cartilage do not interact with the sternum, even indirect. So they do not attach to the sternum at all. They do not connect to the sternum at all. So they give impression of floating of ribs. But rib number 10 is actually variable. Rib number 10 is actually variable. It can swing between false rib and the floating rib. False rib and floating. So we have true ribs, false rib, and the floating ribs, depending on how they interact, with the spine. But again, with the sternum. But again, the ribs can also be divided because these ribs are they are coming from the sternum, from the vertebra, and they are floating, so they are called the vertebral free. But again, ribs can also be divided into 2 groups. Depending on certain features. So we have typical ribs and atypical ribs, and they are called typical because they have the certain features in common, and these are the features: head with the 2 articular facets. They are expected to have neck, tubercle, shaft, and the costal groove. So we expect to find these features to all the ribs. This is why we call these typical features, the features of a typical ribs. What are these ribs? Rib number 3 through rib number 9, they are typical because they have these features in common. But the remaining rib number 1, number 2, 11, 1, number 2, 10, 11, and 12, they are typical. Why are they atypical? Because they do not follow the general rule. And what the general rule here? The general rule is having all these features in the same rib, all these features, but these they choose to they lack features, or they have something in the excess that is not related to these features above. So we're going to discuss the features of a typical rib, and I remind you again, the typical rib is rib number 3 through rib number 9. Why are they typical? Because they have these features in common. So they have a head here, and the head has got 2 articular facets. Why 2 articular facets? I told you the other time, one rib is expected to form joint with the 2 adjacent vertebrae in such a way that the superior articular facet of a rib is actually articulated with the inferior costal facet of the vertebra above. What do I mean here? For example, this is the rib number 6. The superior articular facet of rib number 6 will articulate with the inferior costal facet of T5 vertebra. And then also have the inferior articular facet here. The inferior articular facet of a rib will articulate with the superior costal facet of numerically same vertebra. Meaning that if this is rib number 6, and then the inferior articular facet of rib number 6 will articulate with the superior costal facet of T6. T6 vertebra. We already discussed this with discussion of the thoracic vertebra, and you can always go back and watch the discussion of the thoracic vertebra. So we have the neck here. Because of head, you have a neck, and this is the neck of the rib. But we have the shaft, or the body of the shaft of the rib. This is the body of the shaft of the rib. Between the neck and the shaft, you have a tubercle. This is the tubercle, but the tubercle has got articular surface and a non-articular surface. The articular surface or articular facet of the tubercle will actually articulate with the transverse costal facet of the numerically same vertebra. What do I mean here? If this is rib number 6, for example, the articular facet of the tubercle will articulate with the transverse costal facet of T6 vertebra. We've already discussed this joint, the costotransverse joint the other time. But we have a groove here, we have a groove here which is called the costal groove, and this groove is for protection of the neurovascular structures, the intercostal nerves and intercostal vessels, and then we also have an angle here which we call the costal angle, costal angle. So these are the features of a typical rib. A normal rib is expected to have all these features. What are the typical ribs? Rib number 3 through rib number 9. So these are the typical features. The remaining atypical ribs. The remaining ribs are typical ribs. Rib number 1, 2, 10, 11, and 12. This is rib number 1, rib number 2. This is rib number 8. And rib number 8 is actually typical, but it's just put here for comparison purposes. This is rib number 11, and this is rib number 12. We're going to discuss each one in turn, seeing how do they deviate from typical structures or typical features. But we expect these are the typical features that we've just discussed there. But the atypical ribs will either miss one of the features, or they will have something in excess that is not present in a typical rib. Let's start with the rib number 1, and I'm gonna put these features here for comparison. Typical features. This is just for comparison. So this is the rib number 1, and why is rib number 1 very atypical? Number 1 is because it has got only one articular facet, and this articular facet will articulate with only one rib. What if I just told you that a rib is expected to form joint with the 2 vertebrae? The head of the rib is expected to form joint with the 2 adjacent vertebrae in a manner that I've already discussed. But the rib number 1 is special, it's unique, because it's only articulated with the 1 vertebra, and that is T1 vertebra. And if you remember the discussion with the thoracic spine of the thoracic vertebra, I told you T1 also has got 1.5 facet. So a 1 full facet is actually for articulation with the head of the first rib. So the first rib articulates fully with T1, because it is not expected to articulate with the cervical vertebra. And the cervical vertebra, they do not have the costal facets to articulate with the ribs. This is why we have. So it's strange, yes, it's very strange, but we at least know why it has full facet instead of having 2 articular facets. That's very, very, very clear. But the rib number 1 is also shortest. It's the shortest rib, but the broadest, the widest rib. It's very, very wide. It's very, very wide. So this is an additional feature. But it is also sharply curved. But another important thing is these elevations, the bony markings on the superior surface of the first rib is very, very, very important. We have an elevation here which is a tubercle for scalene muscle, which it is called the scalene tubercle. Scalene tubercle. Yeah, it has got the scalene tubercle. This scalene tubercle is very important because it divides between anterior and the posterior to the scalene tubercle. We have like a little bit of depression, transverse depressions, or the transverse grooves, and these grooves are very, very important for the passage of the subclavian vessels. We have the groove anterior to the scalene tubercle. This is the scalene tubercle. The scalene tubercle is where the anterior scalene muscle will attach. This is the anterior scalene muscle, or also called the scalenus anterior. or anterior scalene muscle will insert in the scalene tubercle. But this also divides two grooves, one anterior and one posterior, and the anterior groove is actually for the passage of the subclavian vein. So it has the groove for subclavian vein. The groove for subclavian vein is anterior to the scalene tubercle. Anterior to the scalene tubercle. And then we have a groove posterior to the scalene tubercle, which is the groove for subclavian artery. The groove for subclavian artery, but also the lower trunk of the brachial, plexus. And then posterior also we have the the impression for the middle scaleneus, middle scalene muscle, And now I want you now to appreciate that this is the anterior scalene muscle, this is the middle scalene muscle. Between the anterior scalene muscle and the middle scalene muscle, there is a vessel here which is subclavian artery. This is the subclavian artery. This relationship is very, very important clinically, because we're going to discuss later the thoracic outlet syndrome. And the thoracic outlet syndrome, we have a compression of the thoracic the subclavian artery and some other neurovascular structures here because of spasm of the scalene muscles. Why we've seen the scalene subclavian artery is between the anterior scalene anterior scalene muscle and the middle scalene muscle, middle scaleneus. Is that very clear? We also have on the superior surface of the rib number 1, we also have tuberosity for attachment of the serratus anterior muscle. Yeah, so that is rib number 1. Let's go to rib number 2 to see how rib number 2 deviates from being typical. So the rib number 2 is its head has got behaves almost the same as the typical ribs, but what makes it atypical is actually the rough surface for articulation for origin of the serratus anterior. This rough surface is known as the tuberosity. So it's a tuberosity for serratus anterior muscle. This is the only atypical feature of the rib number 2, and this is what makes it atypical. So what happens to rib number 10, 11, and 12? Let's go to rib number 10. This is rib number 10, and the rib number 10, it said has got only one articular facet. But you remember we discussed the other time. When we were discussing the thoracic vertebra, I told you that T10 actually has got one full articular facet. But it can happen that T10 has got a half a facet, and then a half a facet is contributed by T9. So rib number 10 also can behave in the same way, that it can, most of the time it only have one full articular facet, which articulates with the T10, and this is very, very atypical, because we know it should have two articular facets. So at least I'm happy because you can relate to the discussion of the thoracic vertebra, and you can ever watch this before watching the discussion of the thoracic vertebra. Rib number 11 and 12. Number 1, they all have one articular facet. They all have one articular facet on their head, but they do not have necks. They lack necks. They do not have necks, neither tubercle, so they do not even articulate with the transverse processes, because we already said also T11 and T12, they do not have transverse costal facet. The transverse costal facet they do not have, the T11 and T12. So the rib number 11 and rib number 12 also, they lack neck, but not only neck, the tubercles, they do not have tubercles, so they do not form the costotransverse joint. All right, guys, this is what we discussed at that time, articulation between the ribs and the thoracic vertebra, and we already also recapped here, because we have said superior articular facet of a rib will articulate with the inferior costal facet of the vertebra above, but the inferior articular facet of a rib will articulate with the superior costal facet of numerically same same number. So let's see that maybe the joints of the thoracic cage. Also, this is also a repetition. We already discussed it the other time. So the thoracic cage, as we have said, the joint of the ribs, they form joint with the vertebra posteriorly, but anteriorly. Separation, because rib separation is tearing, is this tearing of the rib, disruption of the costochondral junction. A junction between rib and the costal cartilage is known as the costochondral junction. And if you have a disruption here, it is called the rib separation and not rib dislocation. A dislocation is reserved for joints because the junction between the costal cartilage and the sternum is actually a joint, but the junction here between the costal cartilage and the rib is just a junction. It's not a joint. So it is called the rib separation instead of rib dislocation. All right. So another thing is so when you have disruption here, it can result into overloading of this rib and the rib above, causing pain, or it can also result into damage of the structures like lungs within it, and it is so dangerous. All right, guys, this is what I had for you today, the discussion with the ribs. But I hope now you know that you all have 12 pairs of ribs and not more, not less. But if you like this discussion, don't forget to subscribe, share it to your friends, spread the knowledge to your friends. If you have a question, additional comment, feel free to write down in the comment section. I read every comment, but you can always write me an email, and you swing on the TikTok and Instagram account. And thank you for watching. See you really soon. We're going to discuss soon we're going to discuss the rib cage, like the thorax, the discussion of the thorax. See you guys.